doctor-patient conversation and communication is that we give it some attention. And that may be time, that we take a minute or two away from the computer so we can actually talk, some eye contact, and that the patient also expect that this is the most important part of the visit with the doctor. More than the lab tests and the CAT scans and the MRI, the patient should expect the doctor to give him or her several minutes of undivided attention, and the doctor needs to also remember that the conversation is not the addition to the medical investigation, but the most important part, and also give it its time to listen. And the doctor needs to remember not to say anything for the first minute, let the patient talk, and then ask the patient, what are your priorities for your medicine, for your health care? Well, when you think about the doctor-patient conversation and you imagine how many diagnoses can be made, the number of analyses that can be rendered, the number of treatments that can be done, not to mention the doctor-patient connection that can be established in that. In fact, the doctor-patient conversation is a far more intricate, powerful, and flexible technology compared to our other medical technologies that only do one thing in one way. The conversation can do many, many things. So my conclusion after being a medical educator for years is that most of our students, they come into medicine with plenty of empathy and fairly good skills. And what happens to them is we stamp it out of them. So our goal as educators, especially with empathy, is to preserve that. I think children and young students are naturally empathetic, especially those without medical skills yet. Empathy is the easiest part of medicine. So we as teachers need to preserve that. We need to demonstrate how and why it's important. Now, communication skills, that's more teachable. And that we need to demonstrate. And you can't teach communication or empathy with a PowerPoint presentation, with a multiple choice test, or a 1 to 7 Likert scale. We need to show it at the bedside. So for an example, I like to take my students and I ask them, who's the worst patient on the ward, the most difficult patient? Let's talk to them. And then we can demonstrate in real time, how do you use good communication skills to deal with an angry patient, someone refusing treatment, someone too scared to make a decision, someone upset and not knowing what to do. And I think when you see communication well done and empathy well done, that has a powerful effect on the student's education.